everything Mark Cox at 971talk.com/Cox.
Glad you're back with us. We're joined in this segment by Christopher Arps, my friend from MoveOnUp.org, and we're also fortunate to have Congresswoman Ann Wagner joining us from Washington, D.C. Congresswoman, how are you?
I'm good, Mark. Good to visit with you today.
Great to talk to you again. Enjoyed spending some time with you on Saturday night.
Hey, thanks so much for emceeing that. You know, for those of you that are listening, Mark always shows up at the St. Louis County Lincoln Days. There were hundreds of wonderful Republicans there that worked the grassroots day in and day out, and you were leading the pack. So thanks for being there.
Oh, my pleasure. It's always fun to do. You and I talked a little bit Saturday night as you addressed to the crowd as well. Your take on how the healthcare vote went down on Friday and what really happened. Are there any updates on that? Is there anything in the works to keep this moving forward?
There are, and members needed to go home and back into their districts with their families, their constituents. I know I was certainly uplifted by meeting with many of mine over the weekend, and people were frustrated. The president was frustrated. He said he was. We're frustrated. American people are probably the most frustrated. So people regrouped. We got together starting last night and again this morning, and the speaker was clear. The president's clear. We're going to continue to work on it until we get it right. And that's a verbatim from this morning. And I'm not walking away. I am absolutely, Mark, committed to repealing and replacing Obamacare, and with solutions that are going to provide quality health care, not just health coverage. And we're going to do it in a true conservative style. As I mentioned the other night in St. Louis County when I was with you all, it's important that we get it right, not fast. So I'm not walking away. No one's walking away. We're going to get back to work and deliver.
That's good. I've got Chris Arps here in the studio with me. I think he's got a couple questions, too,
hey,
if you don't mind.
Chris, how are you?
I'm fine. Good seeing you Saturday night, Congresswoman.
It was awesome.
I've got a question. I read this morning that the Freedom Caucus members are divided over a discharge petition that contained a repeal of Obamacare, full repeal. Do you have any status updates on that, or where's that at? Or is that gaining any momentum?
I do not have a status update on that. Most of the Freedom Caucus was certainly there with us today at our full conference, and we're trying to pull together and be the united Republican government that we were elected to be, and I'm glad they were there, and they're willing to sit down and work with us. I'm certainly willing to sit down. I had great dialogue with Congressman David Brat this morning of the Freedom Caucus about some ways forward. So we've done a full repeal, Chris, on multiple occasions. Frankly, this reconciliation package had the full 2015 repeal in it. There were some concerns, I think, over some of the replacement items that were also a part of this package. But as I said, it's we're a team, and we're going to continue to work to get it done. And I have great respect for my friends in the Freedom Caucus, as I do those in the Tuesday group. I just want to make sure that I'm representing my constituents and that we're not walking away from this because, as you know, this Obamacare is in a death spiral, and 96 of Missouri's 114 counties now only have one provider, and there is great concerns because the insurance providers have been kind of having their finger in the dike here for a bit. That come this summer and early next fall, I mean, this is going to utterly collapse. Premiums will skyrocket once again, and we need to get back to work on behalf of the American people and see what we can do to repeal and replace this and put free market solutions in place.
And clearly the goal here is to try to bring down these premiums with whatever we end up replacing this with. What's your take on the essential benefits element? Because I know that kind of got added to the bill late in the process, I was told. I seem to think that if you, just like the mandate to have to buy insurance, if you mandate what has to be in every policy, that would have to drive up costs.
Absolutely. Our whole goal here, Mark, ought to be to bend that cost curve and bring down premiums for all. And so we put those essential health benefits, those were put in by Obamacare, 10 of them. And what we had agreed to do was to remove those from the federal piece of legislation moving forward, states can do. Remember, a lot of insurance policy is mandated and regulated at the state level. I'm a big believer in returning power to the states, whether it's what we did with Medicaid, it was the block grants and the per capita cuts. By the way, the package did have about $1 trillion in Medicaid reform, probably the biggest entitlement reform in over 50 years. So there were some good things that all of us, I think, could agree with and come together on. But I don't believe the government has a place in pulling together essential health benefits. Let the states do that if they'd like. Again, our whole goal here is to provide affordable, patient-centered care and get the federal government out of it to the largest extent possible.
Very good.
Another question about the Freedom Caucus, and you don't have to name any names or anything, of course, but last Friday, a Freedom Caucus member resigned, and I was just wondering, are you hearing any talk of others that may be leaving the Freedom Caucus? Is that still are they still cohesive and together, or what are you hearing?
Hard to tell. That was Judge Poe. He's a dear friend of mine. Judge Poe and I work on human trafficking legislation a great deal, and I don't play the blame game, Chris, on this. We're involved in a team sport, and when the team loses, it's on the team. And I'm a member of the team. All of us are, and I hate the camping out, that can occur in any conference or any group or gathering of people. I want to see us work together and move forward. And what was gratifying this morning, honestly, Chris, was the conference was packed, and there was a good dialogue and a fruitful discussion, I think, and a consensus about getting back to work, and also recognizing that we can walk and chew gum. This isn't just about health care. The speaker said very clearly this morning, and the president has lauded and echoed it, that this is the last tax season that Americans have to put up with this broken tax code. So we're moving about the business of tax reform so that people can keep more of their hard-earned dollars and getting rid of. The tax code right now, Mark, is up to 74,608 pages.
Oh, my goodness.
We are trying to move, and certainly Chairman Brady of the Ways and Means Committee is trying to move towards a system where we can file on one postcard. That's what the American people deserve, and they also deserve to keep more of their hard-earned dollar. And we're working on that very in a very strong fashion.
Well, I don't even know why you keep trying. You might as well just give up. The media has already declared that because healthcare failed, you've lost momentum. And I think Lawrence O'Donnell or somebody on MSNBC said the Trump presidency is over.
Yes, well, one thing that I know for sure is if the liberal press and the Democrats had their way, we'd have a single-payer system. So that is something we are not interested in, and I assure you, we're marching forward. We've got a lot to do. We've done a lot. This has been 66 days. Everybody needs to take a good, long, deep breath and look at some of the things that we've done so far. I don't want to get into the weeds, but, we've got these Congressional Review Acts. It's rolling back rules and regulations that were put in place at the midnight hour by the Obama administration. President's now signed we sent over at least 15, I think, to the Senate, and the president signed a number of them into law. I've stood in the Oval Office next to the President of the United States on day 14, and when he signed an executive order pitching out, and Mark, you and I have talked about it, that egregious Department of Labor fiduciary rule that was going to be Obamacare for people's retirement savings. So there's a lot of really good things that we're doing. We're still trying to get our cabinet secretaries in. We don't have the Department of Labor secretary in yet, and we're populating the rest of the agencies and departments and draining the swamp of what I call the swamp monsters, which are these unelected bureaucrats that have burrowed in. And believe me, I'm fighting that fight every single day. And the administration has been terrific to work with. I have been so impressed. I've been to the White House probably 5 of the last 6 weeks, and the president is very engaged, and I think our best days are yet to come.
I'm glad to hear that because, I just wanted to ask this question Saturday night, but we didn't have a lot of time to talk. What's that relationship like? And maybe you answered part of the question, because when you go to the Oval Office and these other Congress people are there working with the president, a lot of them were tepid in their endorsement of him to begin with, if they ever did endorse him. And now everybody's kind of squeezed together, having to work together. Is there any awkwardness there?
Certainly not on my part, or on his. I'm grateful for the opportunity to work with him and to have somebody who's a doer, a man of action, who cuts through all the crap, to be perfectly honest,
right?
And is willing to get to a bottom line, who's a decision maker and cares deeply about the direction of this country, and he wants to move. He doesn't let any grass grow under his feet, and neither do I. We very much share that personality trait, and I've appreciated my engagement with him. I'm grateful for it, and we can't let the liberal press and the media drive this agenda, and you're seeing it everywhere. And it's really not what's on the minds of the American people. This was an incredible election cycle, certainly for the state of Missouri. Clean sweep across the board. Yeah, I said it the other night, Mark, from the county council level all the way up through the President of the United States. And we've got a mandate from the American people and certainly people of the great state of Missouri. And I continue to be just impressed with all that we've been able to accomplish in this short period of time. And as I said, we're going to move ahead with all the President's agenda, whether it's keeping our border safe and keeping our promises in terms of border security and building, that wall. We want the federal government out of everything, from health care to your retirement savings to how we educate our kids, how we practice our faith, all the things that are important for us as a nation. At the end of the day, this is about restoring people's freedom and liberty, and that is what the government and the past administration have robbed us of over the last 7+ years. So that's what I'm working toward, and I do so with renewed energy after a quick shot in the arm. Although it may have only been less than 48 hours, it was good to get home and breathe in a little bit of the 2nd District.
Well, I'd be anxious to see what your frequent flyer numbers look like, because you must have millions of them.
I do. If anybody needs a lift up to Washington, D.C., I was telling some of the spring breakers, that's also exciting. We've got a lot of constituents that are here from the 2nd District, and we'd love to help them out with tours, and if I'm available and not voting or in a committee, to sit down and talk with especially the young people that are here right now. It's pretty cool.
Ann Wagner, thanks so much for your time. We appreciate it.
Always. Take care. Bye, Chris.
Thank you. Good seeing you.
See you now. Thank you. All right. Congresswoman Ann Wagner from the 2nd Congressional District. I had about 10 minutes with her there. Clearly lots of stuff we needed to get into, but health care and tax reform were the two big ones for me, and it sounds like they're still working. They caucused this morning to see where they can find some common ground and try to move this thing forward. I'll get to some of your phone calls. Of course, we'll continue with Chris Arps